Hi class, this is on cardiovascular emergencies. So what causes a heart attack? It's really hardening of the arteries. So if you look at these two pictures here, it's typically hardening of the arteries. You'll see one where the blood is flowing and the other where plaque has built up. And this plaque can be hereditary, that it builds up, or it can be from too much cholesterol in your diet, too much fat in your diet, and it builds up here. And so also it could break off and that could go to the heart, or just you can see it's the narrowing of the artery, and so your blood and it carries the oxygen can't get through. So first we're going to talk about angina. Angina is severe chest pain, and it's the heart muscle is lacking oxygen. So the classifications of angina is the pain results from physical or emotional stress. There's no change in the duration, frequency, or intensity, and it's controlled by a medication called nitroglycerin. The diagnosis is the pain from this lasts 3 to 8 minutes. Angina pain is relieved or eased promptly by nitroglycerin, and anybody who does have angina, of course, has to put that on their health history. So treatment, if you have this in your office, stay calm, stop any dental procedures, administer the nitroglycerin, give oxygen, and then repeat it if needed. But be alert to call 911 because you never know, it could go into a heart attack or could be a heart attack. They might always have angina, but this day they're having a heart attack. Myocardial infarction, which means a heart attack. The muscles of the heart are damaged due to results of oxygen starvation. The signs and symptoms: chest pains from mild to severe, pain in the left arm, jaw, and teeth. It can also go into their back. Shortness of breath and sweating, nausea and vomiting, pressure, aching, a burning feeling of indigestion, and generalized feeling of weakness. A patient could have some of these or all of these, but these are the signs and symptoms you'll want to look for. Treatment: call 911. Administer nitroglycerin, have oxygen, and then go into CPR if the patient becomes unconscious. So how do you prevent this in the dental office? Make sure they have a current medical history. Physician by their doctor if in doubt. So especially if they're going to have any kind of lengthy procedure or surgical procedure, the doctor may very well say, I need to talk to your physician. Keep the length of the appointment as short as possible. Pain control. So the maximum doses of epinephrine, which is in one carpule, is one carpule that a patient should have. Many procedures go beyond that, but just know that epinephrine constricts the artery. You just looked at a picture of the artery already constricted, so if you're constricting it more, just know the more epinephrine you give, the greater chance you're contributing to the patient having a heart attack. Give them oxygen, monitor vitals, be prepared for emergency. Just like the beginning of this course, be prepared, know the signs and symptoms, do everything you can to prevent it. Thank you very much.